this is really an amazing opportunity to talk right to the North Shore community and really reconnect with them and get a sense of how we can work together to make sure that we are delivering the kind of health care that we want to deliver to our community, but also that we're actually offering opportunities for people from all of Staten Island to be able to get good paying jobs that can lead to a career in healthcare, and to get the brightest and the best to stay in healthcare, and to really just kind of get our youth moving to think about how they can actually help people and have a wonderful career.
Well, I think it's very, very key in that the community gets to see Staten Island University Hospital in the community. They get to feel that this hospital cares about the community. We do know that we are dealing with many underserved populations, and we know that COVID, the pandemic, has exacerbated the reality of healthcare disparities, right, and inequities. So this goes, I think, leap years in making the community know that Staten Island University is taking an invested interest in the needs of this community.
I'm sharing some of the work that we're doing at the enterprise level across all of our markets, particularly the work around COVID, the work around the social determinants of health, food insecurity, and some of the other things that are very important in our community. The COVID vaccine is about injecting hope into people, right, saving lives. And here we are in a church, and there's something very spiritual about doing this in a church. One concern is that many people that look like them aren't serving their needs health-wise and otherwise. Another concern may be that sometimes when they go to address certain issues, there's differences in the way health issues are approached with people of color.
Whatever healthcare professional that comes to our community, they must have cultural competency. Very, very important.
Another concern is, quite frankly, healthcare access, accessibility to services. So all of those are major concerns of this population, and we know that it is a fact because we see the disparities pan out in terms of the data. So it's very real.
So being the first winner of the Reverend Maggie Howard Community Hero Award is a very, very important thing, and it really has to be given to the right person, and we really didn't have to think very hard about who we were going to give it to. Debi Rose is a second-generation Staten Island native and the first African American from Staten Island elected to public office.
I am so honored to be the first recipient of the Reverend Maggie Howard Award, not only because she was a very good friend of mine, and I miss her terribly, but the fact that she was such a giving, loving person who was committed to the community. She was always there for anyone who needed her.
So I think a goal of an important session like this in a community faith-based environment such as this is trust. The trust that we encompass with not just the medical field, but those that impart that trust into the community.
This is very important, that there is a sort of a connection, especially when we're dealing with service that people provide to our community, invested stakeholders in the community. That's key. That's what keeps a community. And I don't care what community, the invested stakeholders are the pillars of those communities.